Hello, welcome to TLC DocTalk. Second Thursday of October is marked as the Word Sight Day, with the idea of bringing about awareness about blindness, its causes and prevention, how to treat it, and how to take care of your eyes and vision. I'm Dr. Sanjay Dhawan, Director and Head of Eye Department at Max Healthcare, New Delhi. I, along with Dr. Ekta, will be talking today about cataract, its causes and treatment.
Hello everybody, welcome to TLC DocTalk. I, Dr. Ekta Shah, Head Surgeon at Parshva Eye Care, Vapi, Gujarat, along with Dr. Sanjay Dhawan, would be discussing what is cataract, the causes of cataract, and the treatment options available.
Cataract is the condition where the natural lens of the eye turns hazy or opaque, thereby obstructing the light from entering the eye and forming a clear vision on the retina. What are the symptoms of cataract?
The symptoms of cataract. Patients will commonly complain of diminished vision and looking through a frosty glass, halos around the light, difficulty in reading near, and also difficulty in driving at the night time. So what causes cataract?
There are many causes of cataract, but the most common cause is aging, the so-called senile cataract, which happens mostly after 55 years of age, but can happen anytime after the age of 35. However, even a child can be born with cataract, the congenital cataract, or can develop cataract afterwards, the juvenile or developmental cataract. Various metabolic diseases or disorders can lead to cataract formation, including diabetes, which can also accelerate the cataract caused by the age. Any injury to the eye can cause cataract, the traumatic cataract. Some drugs, for example steroids, can also lead to cataract formation. At what age does it commonly present?
The age group in which the cataract is present is 41 to 60 years and above, and it is uncommonly seen in children and adults less than 40 years of age. So how do I get the cataract diagnosed?
As Dr. Ekta said, that blurring or diminution of vision is the commonest symptom of cataract. So if you experience a blurring of vision which is not corrected by glasses, then you must get your eyes examined by an ophthalmologist or the eye specialist, who will not only check your vision but may also put some drops in your eyes to dilate your eye and examine the eyes in detail using a specialized microscope called the slit lamp biomicroscope, which will show the condition of the lens in detail, and he will be able to diagnose the presence, degree and extent of cataract. How will you know whether you have any other diseases in the eye?
While getting the diagnosis of the cataract done, the ophthalmologist will also let you know if there is any associated disease or disorder of the eye, like abnormalities in the cornea, the shape of the cornea, the pupil size or any irregularities in the cornea, the type of cataract, and also if there is any retinal pathology like say diabetic retinopathy, which also may need treatment at the same time. So the next question is, what are the treatment options for cataract?
The treatment options for a person who is diagnosed with cataract are very few. In the early stages, a person may just require a change of glasses and some simple lubricant eye drops. Because in early stages, when the vision is not too diminished and it is not interfering with the person's life, a person can wait for the surgery. However, if the cataract is advanced, then surgery is the only option available. But there are various types of surgeries which are available to you. The most commonly done surgery is the phacoemulsification, or also called microphaco or MICS, micro-incision cataract surgery, whereby a specialized ultrasound is used to emulsify or soften the hard cataract, and that softened pulp is washed out of the eye. A very pliable or foldable lens is loaded on a special injector and injected into the eye. The other newer option is the so-called femtosecond laser or blade-free cataract surgery, where all the cuts and incisions are made by a specialized laser. This laser also softens the hard nucleus, and then the soft pulp is washed out of the eye and the lens is implanted in the eye. There are different types of lenses which are available, which we will talk about later in our talk. However, how long can a person wait before going in for surgery?
Not everybody needs to go in for the surgery immediately. But if the vision is causing problems in difficulty in reading, difficulty in driving at night, halos, glare, all these complaints may cause a difficulty in day-to-day activity, then the patient should go in for the surgery. At the same time, if there is any frequent change of glasses, that means that the cataract is progressing faster and the patient should go in for the surgery. Now, the next question is, how much should be the time gap between the surgeries of two eyes?
The time gap required between the two eye surgery depends on a few factors. The amount of cataract in the other eye, any associated conditions in the other eye, the type of lens the person is planning for, the refractive error in both the eyes, any other complicating factors in the eye, and of course the age of the patient. If the other eye also has an advanced cataract, we prefer to do an early surgery. However, we still like to give a gap of about 2 to 4 weeks if possible. In a small child where general anesthesia is required, we may not give a long gap and we might be able to do the surgery at the same sitting for both the eyes. If a person has to opt for multifocal lenses, then again the gap between the two eyes cannot be very long. The person has to go for an early surgery in the other eye. However, if the other eye has got an early cataract and a person has opted for a monofocal lens, then one can wait for a longer period before the other eye surgery can be performed. What are the tests or preparation required before the cataract surgery?
The various tests needed for the surgery are medical test and ocular test. The medical test mainly consists of routine complete blood count and blood sugar levels, chest X-ray and ECG. These tests are necessary to get an anesthetic checkup and fitness done before the surgery. Ocular test mainly consists of vision assessment, detailed retina checkup. If need be, you may have to get an OCT or a retinal scan done, and then the test for the IOL measurements. So what are the different types of surgeries and how do I choose a surgery?
As I mentioned earlier, microphaco and femtosecond laser cataract surgeries are the commonest surgeries performed nowadays. In microphaco, the incisions and the cuts are made by a blade or needle. The hard nucleus or lens is emulsified into soft pulp with the use of ultrasonic waves. Then the eye is washed and a specialized foldable lens is implanted into the eye through a small incision of just about 2 millimeters. This is a very established surgery and most surgeons are very conversant with this technique. It's easily available at almost all the places and it's comparatively cheaper. On the other hand, the femtosecond or the so-called blade-free cataract surgery requires a specialized laser, which itself is a very expensive equipment. Hence, the surgery becomes more expensive. There, all the cuts and incisions are made by a laser and not mechanically. The conversion of hard nucleus into soft pulp is also done by the laser, whereas other steps of washing the eye and implanting the lens remains the same. Being a laser technique, it is theoretically more precise, more accurate, gives better results and a faster recovery. Practically, the difference seen in the two is very small. However, for more specialized lenses like multifocal, trifocal lenses, the more precise the technique, the better are the outcomes. So that brings us to the question of what are the different types of lenses available and what are the benefits of each.
What are the different types of intraocular lenses? That mainly they consist of monofocal and multifocal lenses. In monofocal lenses, patient's distance vision is corrected and patients will have to wear glasses for near vision correction. While in multifocal lenses, the distance, intermediate and near, all the three are corrected and patients are more or less free of glasses. There are also certain conditions where there are high cylindrical power which will not be corrected by either of these and patients will have to go in for toric lenses. So how does the patient choose which type of lens to be used for cataract surgery?
Almost all patients these days are implanted with foldable lenses. The non-foldable lenses are used very rarely in some specialized situations. Amongst the foldable lenses, the choice is mainly between the use of a monofocal lens or a multifocal lens. Monofocal lens has got a single focal power which is usually adjusted for far distance, but for reading work the patient needs to wear glasses. Multifocal lens has got 2 or 3 focal lengths which are adjusted for far, intermediate and near vision, hence the need for glasses is virtually eliminated. The choice is of the patient. However, people who have very exacting night vision needs, for example pilots, are usually cautioned against the use of multifocal lens because there is a slight drop in the contrast and the quality of night vision is slightly inferior. But whichever lens you go for in the first eye, you have to go for the same type of lens in the second eye. You should be able to discuss the same thing with your eye surgeon who can help you decide better. How much time does it take for the surgery to take place and for the recovery?
Depending on the hardness of the cataract, the type of the cataract surgery and the expertise of the surgeon, the cataract surgical time may vary from 30 minutes to up to 60 minutes. The immediate post-recovery phase is up to 48 hours, wherein the patient may complain of pain, redness and mild watering. The total recovery time of the cataract surgery, wherein the patient attains full vision, is up to 8 weeks. The next question here is, what do I expect out of my surgery and the outcomes of my surgery?
The outcome of surgery or the visual results do not only depend on the type of surgery being performed or the skill of the surgeon. A lot more depends on the condition of the patient's eye. If your cornea is perfectly healthy, if your iris is well functional, if your retina is functioning at its optimal level, and everything else is fine and there's no other complicating factor in the eye or in your body, then the chances are that you will recover very good or full vision. However, if any of these conditions is not satisfied, the final visual outcome may be limited. Most commonly it is seen that with age there is a degeneration which sets in the retina, the so-called age-related macular degeneration, which limits the final visual outcome. If there is any corneal opacity or corneal degeneration, that can also hamper the final visual results. In most of these conditions, the eye surgeon is able to give a rough estimate of what to expect after the surgery. So it's a good idea that when you are planning for a surgery, discuss with your eye surgeon that what is the likely outcome in your case. What are the risk factors in your eyes or in your body? Not just the risk factors are there in the eye, however, there are risks and complications possible in the surgery also. So what are the possible risks and complications of cataract surgery?
Fortunately, 98% of cataract surgeries are done successfully. but all the surgeries entail some risk and complications. So commonly occurring risk or complications associated with the surgery are post-operative infection, there may be retinal detachment, retainment of cataract piece, displacement of intraocular lens, and increase in the eye pressure after the surgery. So what if such a complication has occurred?
Every surgery runs the risk of complications, and complications can happen even in the best of hands, in the best of situations, with the best of technology. But one should not lose heart, because if complications happen, most complications can be managed with appropriate treatment and intervention. You may require more treatment, you may require more surgery, you may require help of some other consultant, some other specialists, but things can be managed. If things go wrong, don't lose faith in your surgeon. Discuss with your surgeon about what happened and what can possibly be done to rectify that. Does the medical insurance cover the cost of cataract surgery? Does it cover the cost of the lenses?
All the medical insurance company normally cover the cataract surgical cost and may have put up a certain claim limit, which needs to be verified by the patient with the company. The next question is, can I get a cataract again?
In cataract surgery, we remove the natural lens of the eye and implant an artificial lens. So theoretically, cataract cannot come back again. However, the membrane on which the artificial lens is supported can at times become thickened, especially in younger people over a period of time, which may vary from a few months to a few years. This thickening leads to slight blurring of vision and is what is called after cataract. It is very simple to manage. We just have to do a minor laser treatment to open up or cut open this membrane, and the vision is restored to normal again. Will you have to wear glasses for distance or for near or for anything else?
With the advent in the technology and the expertise and the advancement in the intraocular lenses, patients are more or less free of glasses after the surgery. Patients may or may not require to wear glasses for the reading. Thank you for patience hearing.
I hope you all find TLC DocTalk useful and benefit from the same. Thank you very much for your time.